season, as well as an allergy season where you have lots of people who have suffered various complications and things of that nature. Many of them recovered between November and January, and a few who unfortunately expired. They were recording as having expired due to pneumonia or to the flu. Well, is that accurate? And on top of that, so what are some of the implications of this phenomenon? If the coronavirus has been in the U.S. longer than January 21st, that would tell you that its lethality is even less than what is being reported, because you had months that transpired when no testing was happening. Yet we've gotten to where we are now after testing. So if the coronavirus has been in America since, let's say December, late November to December, and we are where we are now, could it be that we're closer to the peak? Could it be that we're on a downside? I mean, it completely changes the conversation. And more importantly, if there were 2 months of this happening and we didn't have the type of scenario that would require a hair on fire response, would a $2.2, $2.3, $2.4, $2.5 trillion hair on fire response be appropriate in Congress? I want every Congress member, it's too late for the Senate, I want every Congress member, before they vote on the coronavirus relief bill, I want them to answer, when did the pandemic begin? Not when they think it began, not the first known case. And if they revert to saying, well, the first known case, I would ask them, well, is it possible that there were more cases percolating in our nation before the first known case? Is that not a reasonable question to ask? Especially if all of these efforts, shutting down our society, shutting down our economy, is all postulated in an effort to flatten the curve. In order to do so, don't we need to know when the curve began? I'm just asking questions, man. Just trying to apply the Bible. Just trying to, before I answer a question, I want to acquire knowledge so it's not to my folly or my shame. Neil Ferguson, the epidemiologist in London, who started all of the panic with his projections of 2.2 million Americans dying from coronavirus, he has now revised his projections. I would like to ask every House of Representatives member, are you aware that epidemiologist Neil Ferguson, who began the hysteria, has now changed his opinion? Oh, you were not aware. So let me explain to you what his opinion is now. His opinion is no longer a hair on fire opinion, so much so that, did you know that the United Kingdom's government has downgraded its lethality analysis of the coronavirus? Did you know that? I'm not saying we ignore it, but what I'm saying is that wouldn't it be more prudent to focus our physical distancing efforts with those who have been demonstrated based on evidence and statistics as being more vulnerable populations, and allowing the rest of the United States of America to get on with the business of living? We don't shut the country down for the flu in every year. Last year, most recently, we had 22,000 people die from the flu. Have you been self-quarantining because of the flu? And we know the flu, in spite of the flu vaccine peddlers, the flu mutates every year. 32 million people contracted, thereabouts. I'm not saying minimize anything. I'm saying, could it be that we are applying a method in response that is not commiserate, that is not equivalent to the threat? That's all I'm asking. That's all I'm asking. I think we need to follow the hand washing guidelines and the physical distancing, especially for the vulnerable populations. But is this worth shutting down the entire United States of America? I mean, a couple days ago, President Trump was having a virtual town hall, and he said this in clip number 1. If you can get that ready, Rob, and play clip number 1.
The cure, it's like this cure is worse than the problem. Again, many people, in my opinion, more people are going to die if we allow this to continue. We have to go back to work. Our people want to go back to work.
I think the president is spot on with that. I'm not saying we be reckless. I'm not saying that we completely disregard it. I'm saying, is it worth considering what Neil Ferguson has said? Is it worth seeing, wait a minute, why is England downgrading this? Let me give you this other piece. There's some in England who are saying, oh, they're able to downgrade the severity projections concerning coronavirus because they had the lockdown in England. Did you know England had only had 2 days of lockdown before the government announced that it was no longer considered the highly infectious disease with the mortality that they expected? Only 2 days. So it surely couldn't have been the lockdown. I'm not saying the lockdown didn't help. I'm sure the lockdown helped in preventing the spread, but the lockdown didn't automatically change the potential lethality. Then you have this report that I just happened to stumble across out of Italy, because Italy has been the nation that many people have been pointing to, saying, hey, we want to be more like South Korea. We don't want to be like Italy in dealing with this. Did you know? Let me get to it. And this is according to the UK Telegraph. All right. Did you know? Well, let me say it this way. What about Italy? Why is their mortality rate so high in Italy? Some have suggested that it's due to their highly elderly population. I've made that observation on this show as a contributing factor. But that doesn't explain why the cruise boat, the Diamond Princess, had elderly mortality rates in line with the rest of the world. So it can't be age exclusively. And I'll tell you, I don't have an answer to it. I'm just asking these questions. These are questions that I think need to be asked. And people much smarter than me should be asking these questions, quite frankly. Well, Professor Walter Ricciardi, who is a scientific advisor to Italy's Minister of Health, did you know that he reported that Italy is overcounting deaths? Did you know that? With all of this hysteria, did you know that Italy is overcounting deaths? This is what Professor Walter Ricciardi said. Quote, on re-evaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity, and many had 2 or 3 premorbidities. Is that being reported in our media? I'm not saying that we should ignore it and take it lightly. I'm saying I think we can be smarter about what we're doing. That's what I'm saying. I'm saying I think we can be more prudent, more deliberate, more diligent, and have a better response to what's happening. And then you have this what little ditty from about a day or two ago, from New York's Governor Andrew Cuomo, when he was waxing poetic about life not being expendable. Listen to clip number 7.
Yeah, my mother is not expendable. And your mother is not expendable. And our brothers and sisters are not expendable. And we're not going to accept a premise that human life is disposable. And we're not going to put a dollar figure on human life. The first order of business is save lives, period, whatever it costs.
Wait a minute. I agree that your mother or any older citizens, they're not expendable. I agree with that. But you have to excuse me if I don't take people like Andrew Cuomo seriously when this is the same dude who lights up the New York skyline to celebrate them passing a bill to allow them to kill children unfettered in the womb. It boggles the mind. It boggles my mind how reckless they can be in making these kind of statements when at the same time advocating for children to be slaughtered. Right now, you got Planned Murderhood in Texas suing Governor Greg Abbott because the governor issued an executive order saying that killing babies is not an essential medical procedure. And Planned Parenthood is saying, yes it is. We have to be able to kill babies no matter what, virus or no virus. And I'm like, so in the same time while we're doing physical distancing, in the exact same time, you're saying, no, you need to have intimate proximity to intrude upon what could only be described as intimate spaces, exposing very vital physical components of people's lives, not to save a life, but to kill one. And to say that that's an essential service. We have our priorities messed up. And again, I don't want anybody to misconstrue what I'm saying. I think we have to take this virus seriously, but I'm simply suggesting we could be smarter about the way we go about doing it. I know that there's some cases, some indications that some younger people have contracted it and are suffering various consequences. But my question, and this is always a hard question to ask, but my question is, we have to evaluate the proportion of those who are suffering more extreme symptoms versus those, like 99% of the people who contract the coronavirus recover. Somewhere between 88 and 93% of them recover spontaneously with no medical intervention whatsoever. Then on top of that, we now have the hydrochloroquine, which should not be confused with the people who drank pool cleaner. It's not the same thing, all right? And you have the hydrochloroquine and a trio of drugs that are used together, 2 additional drugs that are used in addition to the hydrochloroquine. You have the study out of France that had a controlled peer review study that showed a 100% cure rate applying these. When you have the combination of all of these factors, don't you think it's worth us looking again to see whether or not our approach is the most prudent? That's all I'm saying. And hey, we have no qualms. Hey, $2.5 trillion, no problem. Do it. Spend it. Let's do it now. I don't think that's prudent, folks. I don't think that's wise. I wouldn't run my household that way. Then why would we want to run our government that way? Because it's very easy to be irresponsible with other people's money. That's just a fact of life. It's a fact of life. And again, I would certainly love to see wider reporting. Some people interviewing Dr. Neil Ferguson. So, doctor, what was it about your initial modality that you realized was wrong, that caused the entire world to be whipped up into an uproar? I mean, this is the guy, epidemiologist Neil Ferguson, who is now saying, "Oh, false alarm, folks. It's not going to be as bad as I said initially." Yeah, and then England just quietly last week. That's the thing. This is last week. I'm not breaking any news for you. The United Kingdom made this decision to downgrade the coronavirus last week. But you see, that narrative doesn't bode well for the storm chasers in our country. And nor does it bode well for the people like Democrat Majority Whip in the House of Representatives Jim Clyburn, who said, we have before us a great opportunity to restructure things to fit our vision. I'm just asking questions, and I think you should be asking questions too. And I would encourage you to tune in tomorrow, because I'm going to provide some suggestions in tomorrow's program. Y'all have a great evening.
The views and opinions expressed in this broadcast may not necessarily reflect those of the American Family Association or American Family Radio.
Faith, family, freedom. American Family Radio.
The AFA Cultural Institute, a video library of resources dealing with the discussions of our day.
Marriage and family, finances, evangelizing Muslims. The AFA Cultural Institute takes all of these